2 or 3 years now.
Roughly.
Yeah. I mean, you remember that a lot of the things happening now, we did predict that you will find situations like this, that if you have a new virus enter into a population, that what is new to our system, it has to go through, first of all, starts an outbreak, becomes a pandemic, and then ends up becoming an endemic within the community. So I'm hearing this for some of us is not a surprise. What we knew about COVID is that we have several different forms of variants of this. You remember we had the Alpha, we had the Beta, we had the Delta, and the Delta killed a lot from India, if you remember. Then we had the Omicron. The Omicron has given birth to many, many children, giving daughters and granddaughters and all that. So as this moves through the population, you will expect that some of these will happen. Some of the daughters sometimes try and infect, called mild disease. Others can cause severe disease. So what is happening in the state of Ghana, Legon, is for almost 8 weeks, they have some recorded high cases of SARS-CoV-2, which is related to this Omicron subvariant. But in Ghana, there is something we do which is good. We have the National Influenza Sentinel site, where if you have respiratory disease, your samples are collected. This was happening before COVID and also within COVID. It's Noguchi that takes care of it. And then they test for influenza and then many other viruses. They want to monitor the trend of viruses that are happening. So after this pandemic of COVID, they have been testing. At University of Ghana, Legon Hospital, and then the University Health Service Hospital is part of the site that they do this test. And we also have seen, after COVID, if you test 10 people, you have 1 or 2. This is usual. And we've been recording this. We have students who have done research, and if you take maybe 100 samples, you find about 5 or 6 of them becoming positive. A percentage of maybe 2 to 3%, which is usual when a virus assumes endemic levels. But then as you test this and you have percentages rising, so from the 2% they knew, it now went to about 15%. And then within 8 weeks, they now have about 57%, which is what was a bit scary. And this is what triggered the alarm that what could be happening and what should people do.
So what is fueling this?
Of course. We mentioned that, the reason why these variants are important is because of what they are known for, their characteristics.
Okay.
WHO has classified them into what we call variant of concern, variant of interest, variant under monitoring. So once a variant falls into variant of concern, the features are: 1, it has high transmissibility, unusually high. Within a short space of time, it can infect hundreds of people within a unit time. That is unique to that particular variant. 2 is that it's able to cause severe disease, so can cause people to hospitalize and people can die if it's a variant of concern. And then it can also escape immunity. So if you take a vaccine, it's able to escape the vaccine and then break people down and cause disease. So those classifications is what they use to monitor and offer interventions. But luckily for us, what we have now, it used to be a variant of concern in the early days of the pandemic, but has now de-escalated to what we call a variant under monitoring. So under monitoring means that yes, it's able to cause high level of transmission, driven by people gathering, large gatherings, interacting, coughing everywhere, sneezing and all that. So many people become infected. But the good thing about this is that it causes mild disease. So it's not the one that can cause people not to breathe, difficulty in breathing, requiring oxygen, becoming hospitalized and all that. So it is something that is a bit manageable.
And you're talking about the Omicron variant? The
Omicron subvariant. So there are 2 of them. We have subvariant JN1 and then LF. This is what we saw. But these same subvariants, we saw them before in 2023. And these variants are also covered by the vaccines that we took, both AstraZeneca, Pfizer, and all of them. They are part of the package of vaccines. So, although it's a problem, it's not really something that we think could drive people to the hospital, requiring ICU, admissions, and like what we used to do, that can really cause problems. So it's a bit on a mild case, but
you make it sound as if there's nothing to be worried about. We don't have to be scared. Am I reading your mind correctly? That's how you make it seem, because there's so much of a problem.
COVID, as I mentioned, has assumed an endemic level now. So is like a common cold. It's now like common. Anytime somebody sneezes and coughs, and you test the viruses that constitute this, you will find COVID among this. So this is why I thought that if you say it's localized to the University of Ghana, I don't think it's University of Ghana alone. There are many of the other boarding schools that may have people coughing and sneezing. If you take 10 of them and test them, you are likely to find SARS-CoV-2 within this.
So the weather has changed. It's quite cold. So people have the influenzas or the flu.
Exactly.
People have runny nose and coughing and all that. How do we know? How can we tell the difference between this is COVID or Omicron from a normal influenza or flu symptom?